Testosterone replacement therapy can potentially help with beard growth in individuals who have a clinical deficiency of testosterone, also called hypogonadism. Hypogonadism is a medical condition in which the body does not produce enough testosterone, which can lead to a variety of symptoms, including reduced facial and body hair growth. Here's how TRT may impact beard growth. Adequate levels of testosterone are necessary for the development of secondary sexual characteristics, including facial hair growth. Testosterone plays a vital role in stimulating the hair follicles on the face, leading to the growth of facial hair, including the beard. TRT may also result in the thickening and darkening of existing facial hair, giving the appearance of a fuller and denser beard. It's important to note that the effectiveness of TRT for promoting beard growth varies among individuals and is most significant in those with clinical low testosterone levels. If you suspect you have low testosterone levels and are interested in TRT to address this, it's crucial to consult with a healthcare provider. If you are already on TRT and want to check out this Dermatologist Ultimate Beard Growth Protocol, check out the video in the description and pinned comment.